Okay, our next guest is a medical doctor who has taken a special interest in marijuana. Here's Dr. Emily Kelly. Crazy thought. I'm sure you heard this. What's up, Doc? Right? That's awful. That's terrible.
That was terrible.
That was terrible.
Yeah. Agreed. We're going to cut that.
That's the first time you've heard that. Isn't it?
It's actually the first time I've heard that. I don't think anyone else thought it was worthwhile, but way to go.
It wasn't run by me before the show.
So, how long have you been a doctor?
Oh, I think it's been almost a decade now. In fact, about 10 years. I went to Western for medical school. I went to Western for my residency in family medicine as well. My main gig is as an emergency room physician. I have never worked in town, so I don't think I've had I'm going to say the misfortune of seeing anyone, because no one ever wants to be in the emergency department. I'm over in neighboring town of Exeter most of the time. But I sort of wanted to do something a little bit more personal, where I had more time with people. So that's kind of how this whole cannabis clinic got started.
That was what I was going to ask you too. Is not normally a question I ask my doctor, but what got you into pot?
You know, it was the patients who were using cannabis. So when I was training, medical marijuana was legal. In fact, medical marijuana has been legal in Canada since about 2001. I don't think a lot of people really realize that. But it certainly wasn't widely accepted. Those early patients were using it kind of at great personal risk to themselves. These people risked arrest to try to access a medicine that they stated was helping them. I remember doing a rheumatology clinic in my second year of residency, and some folks who were suffering with rheumatoid arthritis had been trying cannabis and finding it helpful. They struggled with telling their physician about that, and some physicians were very accepting, and other physicians pretty much told them that they didn't want to see them in their clinic if they were going to keep doing that. And I knew at that point which side of that I was going to come down on, which is that I always wanted to empower patients to have an informed decision about their own care, and that's kind of why I got into the whole cannabis thing.
So what's the difference between marijuana and medical marijuana? I don't know the difference.
It's the person who's taken it, really.
Okay.
In fact, it's the same flower. It's easy to lose track of the fact that this is a flower. It grows on a annual shrub. We've bred it so that it produces more and more THC. Most people.
Sorry, can I stop you there? What's the difference between THC and CBD?
That it's very important to get into that. CBD is something that is probably broadly safe for most people.
And what applications would CBD?
What is CBD? I have no idea.
CBD is it's a molecule in the cannabis flower. The trick is you can't get high from that molecule. It's an anti-inflammatory, so it can help with pain. Some people find that it helps with tremor. Some people will find that it helps with anxiety, whether it's being able to get out of the house or whether it's being able to get a good night's sleep at night. CBD is the safer of the two molecules, certainly well tolerated. Something that can usually be used safely even by people who are elderly or who have complex medical conditions. Still got to be careful with anyone who's under 25, but more possible. THC is the more traditional recreational molecule. This is the one that people were smoking, back in the 60s and 70s and before then, like a long time before then. And it has a psychoactive effect that we call getting high. Usually that's not why a medical user is taking it. Usually they need the THC for pain relief or nausea relief. But sometimes that psychoactive effect is part of the medical therapy as well.
Where do you see the largest growth in users? I have a friend who recently told me a story about his grandmother who has been using it for pain management. She's put back on weight and she's much more, her pain is managed and she feels very alive and she would swear by it.
Yeah. I don't want to come off as pushing cannabis as a panacea, because there are many people who will try it for whom it won't be effective. But some people will try it and it really will work very well for them. The group that we see using more of it who would never have considered using it, I think even as recently as 5 years ago, is older people. So, whether maybe the 75 plus set is probably the largest growing group. I think we'd probably all be surprised by how many people of all age groups were using cannabis this whole time. But in terms of people being open about it and using it for a medical purpose, you're seeing many, many more older people using it for arthritis pain or difficulty with sleeping, or any issue that they've taken to their family doctor, tried usual pharmaceutical techniques, and if that doesn't work, perhaps cannabis could help. And mostly what I do is just try to give people information about that so they can make their own decision about whether or not to give it a shot.
A question that often comes up, is it addictive?
Yeah, it can be. CBD, no, I don't think so. THC, yes, it can. It does not come with the same kind of withdrawal symptom that you'll see for alcohol, for example. Someone who has a particularly bad addiction to alcohol can actually die from that withdrawal. Cannabis the situation is not that severe, but yes, you can become habituated to it and need to take it more frequently. It's one of the things you need to be aware of before getting started with it.
Do you feel the stigma is starting to decrease?
The stigma is starting to lift, I think. But there's still a lot of conversation that we need to have about how much of a safety boundary we want to drive around activities that take your full responsibility as a fully aware person, like being at work or driving a car. We have not really quite solved where everybody's comfortable around those areas. Obviously, nobody wants anyone to toke and drive. That's a supremely dangerous idea. And in fact, if cannabis kills people, that's probably how it does it, is usually you do something silly, like get into a car while you're still high. But I think that we're going to see the stigma continue to decrease as long as we can keep having an honest conversation about what the real pros and cons of cannabis are.
Do you feel the Dorito company is going to benefit directly from this?
I think they have. I do think they have, and those are definitely an addictive product. That's a joke.
I don't get it. I'm sorry. Poor innocent me.
We have Doritos at home, right?
I'm a Cheetos lady myself.
So with cannabis available legally sold in stores now, why does somebody even need to come to you?
Well, I think the main reason people come to me isn't the availability of cannabis, the price point on medical cannabis, or the cannabis that you're going to get at the OCS.ca Ontario store, or some of the places that are open in London or Kitchener-Waterloo. There's no price point difference. What you're coming to me for is medical advice. So I think that many of my patients have had an experience of speaking with their own family physician about this, but everybody knows how busy your family doctor is. And if it's not life and death, a lot of the time it's hard to get your GP to engage with that conversation. I have time. So I have my average patient visit is about half an hour, and we have time to talk about where you're at, what medical condition has led you to come here, what your experience with cannabis is, if you have any, maybe what you're afraid of might happen, or maybe you've heard some rumors, and I can either confirm them or dispel them, depending on what's appropriate. Another reason why you would want to come to me would be if we do decide that medical cannabis is appropriate. There's a difference in between something being prescribed by a physician and deciding that you're just going to do it yourself. And I think that whether it's your employer or your insurance company, that makes a difference.
So if somebody wants to make an appointment, how do they do that?
Right now, I'm at the Stonetown Chiropractic and Wellness Clinic on Water Street at 19 Water Street. And you can call the receptionists there. I've got appointments available, I think, starting in October at this point. Their number's 226-661-0130.
Again?
226-661-0130.
Backwards as a jingle?
0310166.
So just to be clear, does everybody who comes through your door... Well, Belle.
No, dogs do not leave with a prescription for cannabis.
But does everybody get a prescription that comes through your door? Or do you sort of say,
No.
it's not for you?
There are some people for whom it really will not work. Particularly very strong family histories of psychotic disorders. We do know that THC or possibly even CBD could make that worse. In the under 25 set, I am much more likely to only prescribe CBD, but that is still a medical prescription. Generally speaking, I do like to help people to give cannabis a try if they think that it's appropriate, but they need to be responsible enough to look at what the risks and benefits are. Yeah.
Okay. Oh, Belle seems to have a question. Belle, what's your question? Now she's quiet.
Just one more quick question before we finish up. Edibles will be on the market soon. How do we deal with that?
My advice for anyone who wants to use an edible, especially if it's going to be a high THC edible, is by all means try something inhalable first. Now, of course, smoking is not good for you. Putting any plant on fire and inhaling it is not good for your lungs. It's not good for your heart. Use a vaporizer to reduce that risk. But the reason why you really want to try something inhalable before an edible is that the edible high will last for 6 or 7 hours. If you don't like it or if you get the dose wrong, it can be a very bad trip. With something like 1 or 2 inhalations from a vaporizer, if it doesn't go well for you, you'll be down in about 45 minutes at least.
Okay, well, Emily, learned an awful lot today. And folks, if you have any more questions, she'll hang around after the show, correct?
For sure.
And then you can always go into her clinic, too, and get the answers you need. Thanks for coming into the show today.
Great.
Appreciate
Thanks,
it.
John.
Very much.
Dr. Emily Kelly. Oh, no.
I don't think
half of the show.
I don't think we pay them enough. They're sharing the same cigarette.